In this mini lecture, we're going to be talking about learning for mastery. In college, and especially when preparing for healthcare professions, you need to learn for understanding, not simply memorize facts. It's important to understand why the information is important and how you can apply it. Part of getting the most from your studies involves identifying your learning style. Individuals learn differently, and you need to identify your dominant learning style so that you can use appropriate strategies. Are you a visual learner? Visual learners learn best from seeing, and so study techniques involve reading, studying illustrations, watching a DVD, or making colored illustrations. Are you an auditory learner? If you are, you need to hear lectures, music, tapes, etc. You might not learn best from reading. You learn best from listening and hearing. So you may listen to a CD or tape. You can ask your professor if you can tape lectures so that you can listen to them later. Auditory learners often read out loud because that's how they learn best and create rhymes to remember information. Kinesthetic or tactile learners learn best from hands-on activities. So if this applies to you, it's important that you perform lab activities, put models together, and even stand or move about while reading. Again, what's most important is understanding your learning style. It's also important to understand the specific challenges you may have and how to meet these challenges or overcome them. For many adult learners who are returning to school, they may worry about this new environment. Although it's important to remember that adult learners have lots of experiences and skills they can apply. For all students, and especially adult learners, finding time for studies is very difficult. But I want to mention that you must find time for studying. There is rarely a course in which you don't have to devote a good amount of time outside of class to studying. In fact, for every hour you spend in class, you probably need to spend 2 or 3 hours outside of class. So managing time is important. Creating a to-do list, scheduling time, setting times for family members, asking for help is very important, and delegating tasks to other family members as well. It's important that you establish good work habits. Now's the time. These established work habits will help you not only meet the demands of the courses before you apply to a healthcare program, but in these challenging programs as well. Care about others. Show respect for your classmates and your professor. Be courteous. Be honest. Do your own work. Be dependable. Make it to class on time. Do your assignments and submit them on time. This is very important. I have to share with you that the students who don't pass Allied Health 101 with a C or a better, it is primarily because they do not submit their work. You need to understand that all work must be submitted. Getting a 0 can impact your grade quite a bit. Practice working well with others as well. In this class, we'll be working on a team project. It's also important to be flexible, be willing to cooperate, be willing to learn. If you have not yet made school a priority, now is the time to do it. Students that succeed are students who make this one of their, if not their top priority. Now, as you're learning to become a scholar in college, it's also important that you think like a healthcare worker. So, we already mentioned that you need to understand information, not just memorize facts. It's also important that you know how to approach problem solving and how to apply the information you learn to new situation. When you make a decision, base it on facts, not feelings, and try to see how different pieces of information or different facts are related to each other. Make sure when you investigate or study that you use reliable sources of information. We should be using evidence. We should be using science and solid research. We should base decisions on ethical principles, and of course, through it all, we need to practice good communication skills. We'll have a unit during this course in which we practice communication skills. It's also important that you understand which tasks are legally allowed in the profession that you choose. So, when you're thinking about information, ask yourself questions about it. Gather information, learn more, expand your view about the subject, and don't just accept or assume. So what you see here is someone who thinks like a healthcare professional, investigates, looks for solid evidence, thinks outside of the box, and certainly doesn't accept things at face value. You can use the W questions to learn more about information or to help you study and understand what, why, who, what, when, and 1H, how. When you come to college, sometimes it's also an adjustment to understand the role of the instructor. Sometimes in high school, students are told what to learn by their instructors. In college, your instructor is more of a guide. So instructors may ask questions rather than tell students what the answers are. Let's talk a little bit about problem solving. In your textbook, they outline an approach to problem solving. You can use this to solve problems in your everyday life, in your academic life, or in your role as a healthcare professional. The first step is to identify the problem. Then gather information, create alternatives, choose an alternative and take action, and then evaluate and revise as needed. Let's look at these in a little more depth. The problem is often misidentified, so you need to understand whether this is a symptom of a problem or a real problem. For instance, you may think getting marked late in a class is the problem, but actually the problem is not getting to class on time. Sometimes it can make you uncomfortable to actually identify the root problem. Look beyond the obvious, use the questions effectively, and remember, denying a problem does not make it go away. Secondly, gather information. We need to use accurate and reliable information, and we need to avoid assumptions, opinions, and emotions. Gathering information in healthcare is known as assessment. We collect objective data, known as signs, and this is information that can be observed or measured. And we collect subjective data, known as symptoms, and these are often needs, feelings, and desires. When you gather information, if you're conducting research, ask for help as needed. Our librarians are excellent at helping students. And always question whether you're looking at the facts and whether they are from a reliable source and they are scientifically based. That's very, very important. The third step in problem solving is to create alternative solutions. So you want to, in solving your problem, generate possible solutions, consider all possibilities, and then consider potential positive and negative consequences of each alternative. Discard things that are clearly impractical or unworkable. And finally, choose an alternative and try it out. You have to take action. You have to follow through, and if you followed these 4 steps so far, you should have some good confidence that you've made the right decision. But this is always followed up by step 5, which is evaluate and revise as needed. So after you've chosen a solution and utilize that solution, you need to return to it and review the results of your actions. So this is very important. This is a continual process. Be sure to complete the response to mini lecture B.